Your health is your power, but are you truly taking care of it? Every day, millions face health challenges, but knowledge can be the difference between life and death. From first aid to chronic diseases, mental health to nutrition, we cover it all. We break down complex health issues into simple, practical tips so you can take charge of your well-being, because your health is our priority. That's why You and Your Health, in collaboration with Police Hospital, is dedicated to serving the medical needs of our community. With a team of experienced professionals and state-of-the-art facilities, we offer comprehensive medical services from emergency care to specialized care. We bring top medical experts to answer your biggest health questions and empower you with life-saving first aid techniques and knowledge. Tune in Mondays and Wednesdays at 10 a.m. with repeat on Tuesdays and Thursdays on GH Police TV and DSTV channel 362 and all our other social media handles. You and Your Health. Let your health be your priority. Hello lovely viewers, welcome to You and Your Health on GH Police TV, the program where your well-being takes the center stage. I am your host, ASP Kafui Agyemang. Today we turn our spotlight on one of the pillars of healthcare, nursing. The face of police hospital, that is in patient care, is rapidly evolving, and this change is driven by dynamic leadership, innovation, and renewed focus on excellence in service delivery. Today, we'll explore how strong nursing leadership is shaping the future of patient care, restoring trust in the healthcare system, and transforming healthcare delivery one patient at a time. You will not want to miss this conversation. Today, our topic is nursing leadership and the future of patient care at the police hospital. We are live on GH Police TV, on DSTV channel 362, on Facebook, Instagram, and YouTube, Ghana Police Hospital, and on Twitter, police_hospital. Our emergency line is 053 4666 505. To help us understand and digest this insightful topic, we have in the person of Chief Superintendent of Police, Dr. Kennedy Japiong, Director of Nursing Services. Sir, you are welcome to GH Police TV.
Thank you, my dear.
Health. So moving right into our conversation, we want you to give us a brief overview of your role as the Director of Nursing Services and what inspired your career in nursing leadership.
Thank you once more. The Director of Nursing Services is a traditional role which is in tandem with that of best practices within and beyond the country, and that is the overall supervision of nurses, midwives, and other cadres within the profession. In other words, as the overall supervisor when it comes to continuing career development and education, inspiring leadership, restoring confidence and competences in nurses and midwives and other cadres within the fraternity.
Nursing is quote unquote a woman's thing, yeah. To have a man rise up to this level in the police command and even in the nursing command, what inspired your career from the very first time?
Thank you once more. I would say it's divine, because the early years of my life had been that I be an accountant.
Okay.
Fortunately, I found myself excelling in the biological sciences, okay, and for that matter I veered into sciences, and my passion to leverage the downtrodden and empathy for human life found me in this profession. It has been that of endurance driven by competences and good leadership, and that has led me this heights.
Wow. So what's your biggest motivation in driving change at the police hospital?
My biggest motivation, if it is a variable to talk about, has to do with leaving a legacy of a generation of nurses and midwives who would take up leadership mantle, and that will ensure that the profession is in shape when it comes to competences and assertiveness, such that their spaces can be occupied without the needless fear or favor.
We all know how the police hospital looked like in some years back, and now what we are seeing. What has been some of the challenges when it comes to the nursing department or the nursing directorate? What has been some of your challenges, and how have you dealt with those challenges?
Yes, with the challenges, it had to do with the assertive nature of nurses and midwives, their competences, and their zeal for continuous education and career development and path navigating. And so when I took the reins of leadership, I had to bring a lot of innovations on board, and which included encouraging and ensuring that they were equipped to develop the interest to go to school, build their confidences and competences, and to put them in a limelight that they will be able to occupy their spaces. Dovetailing into that is it was the constitution of committees that will ensure that nurse managers were given the free hands to be able to operate at their levels, and this in a way mentoring the younger ones to appreciate that leadership is not just about people on top but at all levels, and to also instill in them discipline that is standing test of time, and that leadership is not about suppression or oppression, but it is about togetherness and operation of individual and unique abilities. And this I was able to chalk the successes so far that we are seeing.
Wow, interesting. So from the nursing directorate, what has been some of the major transformation that has happened with this transformation?
Yes, if you had followed the directorate in the past, you realize that there was non-existence of a secretariat. But my reign ensured that there was this aspect which I introduced, the nursing secretariat. We now have a secretariat with staff, and it is operational as though a whole department with personnel performing without necessarily, stifling the effort or otherwise the duties of the nurse managers.
Okay. I know of the EMR system in the police hospital currently. How has it helped with service delivery and patient care?
Thank you very much. It has really helped tremendously. Before the introduction of the EMR, nurses had to do a lot of writing, and sometimes when you write too much, there are, the high possibility of entering your procedure report in errors.
Errors, yeah.
And now that we have the EMR, it has replaced this issue of handwriting and making a lot of mistakes. In it is a component of the nurse meet, and I believe you understand when I say nurse meet, that is the nurse midwife model 2 that has all the elements as in the nursing care plan. And so you have the diagnosis and your interventions and your evaluation column, and it is just the click of the button is opened, and this was one of my input into the EMR. And so it has really lessened the burden of nurses and midwives within the facility.
So you're still watching You and Your Health on GH Police TV. So moving right into our next set of questions. Improved infrastructure. What infrastructures has been put in place and currently helping with patient delivery and all that?
Yeah, when you go around the hospital, you would observe that, especially on the wards, there have been some renovations and putting in place of fixtures and fittings. There have been replacement of the beds and improvement in the nursing working areas, and this alone give a very inspiring ambience, and not only contributing to patients' time of recovery, but equally ensuring that there's confidence built in patient towards the care that they receive. We have also been able to expand the hospital annex, and now we have the new OPD, which is separated from the emergency unit. And so if we talk about the downtime of patient, to mean the waiting time of the patient is reduced.
So a shorter waiting time.
Shorter patient waiting time. And so when you look at the antenatal area, which is commonly referred to the weighing area, you would have observed that is now an ultra-modern room, installed with ACs and ceiling fans, where mothers and newborn can cool off when they attend the hospital. And we didn't have these ones. We've also been able to allocate an area for, a parking area for, patients and relatives who would have come. We didn't have this in place. We've been able to introduce a mini mat, if you like, a mini canteen, which such that patients and relatives would not walk across the roads when they are waiting to be seen. So you can just be there. And that area too, there has been an introduction of a mini lab. You don't know, there's no need for you to walk, from the outpatient area to the main laboratory for samples to be taken. We equally putting up a mini shop for the hospital, and this one is spearheaded by the local welfare of the police hospital. And so a lot of things are ongoing.
I know there is a QR code where you can actually scan and then put in your suggestions. That's patients and people that visit the hospital. Have you had any positive feedback from people, and what are they saying?
Yes, thank you very much. I believe you appreciate the fact that customer care, for that matter, good customer care, will require that you have feedback from your patients and relatives. And for this reason, there was that visionary, suggestion to have this type of system in place, and this was led by the quality assurance team of the hospital. And so far, it's helped in shaping our care delivery, system. We've received both applauding feedback and some to queries, which we are working on. It's a human institution, and people will have different interpretations about what goes on in the hospital. And for that matter, we are working on it. So far, it is that we can't say good.
If you just joined us, this is You and Your Health on GH Police TV, and we have been talking about nursing leadership and its transformative impact on service delivery. Don't go anywhere. We'll be right back after this short break.
Your health is your power, but are you truly taking care of it? Every day, millions face health challenges, but knowledge can be the difference between life and death. From first aid to chronic diseases, mental health to nutrition, we cover it all. We break down complex health issues into simple, practical tips so you can take charge of your well-being, because your health is our priority. That's why You and Your Health, in collaboration with Police Hospital, is dedicated to serving the medical needs of our community.
With a team of experienced professionals and state-of-the-art facilities, we offer comprehensive medical services from emergency care to specialized care. We bring top medical experts to answer your biggest health questions and empower you with life-saving first aid techniques and knowledge. Tune in Mondays and Wednesdays at 10 a.m. with repeat on Tuesdays and Thursdays on DH Police TV and DSTV channel 362 and all our other social media handles. You and your health. Let your health be your priority.
Welcome back. Thank you for staying with us. This is You and Your Health on GH Police TV, and we are in conversation with Chief Superintendent of Police, Dr. Kennedy Japiong, Director of Nursing Services. And we have been talking about how the transformation at the police hospital is impacting service delivery and patient care. Sir, moving right into our next question. I know earlier on I asked about I made a comment about nursing being a female-dominated career. How have you been able to sustain yourself and maintain composure all through this career journey?
Fortunately, I am the love king, and because I have a big heart to contain, I've been able to manage. Along my career, I did not only study nursing, I also specialize in psychology. I'm a clinical psychologist, and my study has taken me through. And for this, I've come across perspectives of human behavior. And for this reason, it's helped me a lot to understand and appreciate the nature of a feminine. And this has taken me through. So. And coupled with the multidisciplinary approach of leadership, I always put it, I'm a multifaceted, leader. So situating it to circumstantial and case-on-case based leadership, I've been able to navigate and being able to come along with them.
Being the love king, is there a way your nurses approach you? Is there a day you've set aside? How do you communicate with them effectively?
Yes, being a love king is that my love is proportioned, equally, without necessarily discriminating or
biases.
Otherwise, avoiding some category. And for this reason, I have part of my duties instituted an open day for all category of nurses and midwives. And with this, I'm able to meet them one-on-one on their unique needs and able to profile the needed suggestions, guidance and counseling for them. And this has earned me the name Love King, the father of all.
The father of all, I agree. Beyond infrastructure, how has the culture of nursing changed in the police hospital?
Yeah, you would observe that communication is one of the key elements when it comes to care delivery. Effective communication, as I always put it, ensuring that patient and relatives are able to, come along with you, appreciate what you are saying, and being able to respond accordingly. It is one thing that I have leveraged my nurses and midwives on, and you realize that it is an element that would ensure that the care that they give is improved. Beyond that, it's about competences, and you cannot build competences without continuing professional development or career path navigation. And it is one that I have consistently inspired my nurse and midwife to leverage themselves by going back to school, either on formal basis or informal basis. We've been able to do this, and currently we have, a good number of our nurses and midwives back in school on steady leave, and others are taking models which are not necessarily within the classroom, by leveraging themselves.
Wow.
They have also been inspired to assert, and assertiveness is that you ensure that your space is not occupied, whilst ensuring that you do not necessarily deprive others of their space. And this should not be interpreted into arrogance or pride, but ensuring that you remain within the care delivery chain.
What measures have been put in place to sustain the momentum of this transformation when it comes to nursing education, mentorship?
In summary, I'll put it as tender, loving care of a leader. A leader who is embracing, a leader who is listening, and a leader who is at all time ready to serve. This is not to pride myself, but it is one thing I have tried over the period to ensure that is demonstrated. That to be a good leader, you must lead an exemplary life, empathetic and ready to serve those you expect to serve you.
What legacy would you like to leave behind for the police hospital?
Yes, the healthcare delivery chain is a theme. But if I want to be that isolative to the perspective of nursing and midwifery, I want to leave a legacy. And my legacy is that of a generation of nurses and midwives who are prepared to take up leadership. Challenged as in clinical faculty and academic faculty. I really have a vision, and some will say a dream, before our exits, sooner or any other time. I have given my target that the faculty, the clinical faculty and academic faculty of nursing and midwifery within the Ghana Police Health Service should not be limited to just MPhil and MPH, but PhDs. And currently I am mentoring some of the nurses and midwives who are ready to take up that challenge to enroll themselves onto the PhD programs. So I shouldn't be the only a cadre with such a qualification. And so my dream is to ensure that we have a larger faculty, both clinical and academic.
So coming to the welfare of nurses, what welfare plans have you put in place in this transformation journey?
Yes, traditional nurses are said to be caring and loving. And within the health chain, nursing and midwifery is said to be the pivotal point. And without the nurse midwife, the care chain, the delivery chain will be halted.
Will be broken.
So it will be halted completely. Okay. So we are the spine of the delivery chain.
Agree.
Yes. So we do a lot of work. Sometimes the invisible, work. And so when it comes to welfare, we have developed a system on our own that take care of us. We have a fund, nurses fund, which the nurse managers man. It is generated within the unit and departmental level. Aside, we have an educational committee who serves as the in-service training unit for student nurses and other cadre of nurses who come. And sometimes we leverage on the few notes or cash that we get, which we we gather them as and when we need it. We are able to leverage on it. Apart from that, it is also working towards market premium, which is key. And currently, I am tirelessly working towards the rationalization of the nurse midwife market premium. I mean, all category of nurses and midwives, or cadres within the fraternity, together with the medical director and the head of finance department, we are coming out with a model that will leverage nurses and midwives. In fact, it is a composite exercise that we are doing, and very soon we would it to be demonstrated. Beyond that, the nurses also contribute towards their mother union, and the benefits that members in good standing enjoy. All nurses and midwives who are in good standing are entitled to it, from the district, regional to the national level. If you don't mind, I have also, in a very visionary manner, tried to constitute the Nightingale, the regional clinics, and currently we even have the main hospital in Kumasi, and one is coming up in Tamale.
Wow.
So we are taking up the country, and so nurses being the bulk of the workforce, we definitely need to belong exclusively, and this I'm working together with my team towards that.
You just mentioned the satellite clinics, the clinics in other regions and hospitals. How has your relationship been with them over your time as the Director of Nursing Services?
I must say, admittedly, that for some challenges, I've not been able to do a nationwide coverage of the satellite clinics, but very soon I'll embark on a visitation. However, I have a coordinated central point. My office has been computerized in such a way that at the press of a button, I know who is where, and I can easily relate with the person via voice phone.
Okay. That's beautiful. What message do you have for the young ones, young nurses who want to veer into or venture into nursing leadership?
Yes, so my strong suggestion to the younger ones, especially nurses and midwives, is to cultivate the habit of being patient, avoid unnecessary competition, be focused, and be ready to be mentored. In the sense that nursing is a committed profession. Without commitment, you will not be able to endure as a good nurse or midwife. And so their allegiance should be to the profession, especially leadership. To say that when you are not ready to serve, you will not be served. And so I encourage them to be abreast with modern practice in nursing and midwifery, and this they can succeed by leveraging themselves into continuing professional development and career path navigation. And so I encourage them to, I have this philosophical statement that I always make. When you find yourself comfortable, just know that you are at the wrong place. And so continuously you should be sweating. When you are sweating, then it means there's need for you to change your location. And changing location means you build your capacity and competences. And when you do that, you will be able to assess your space. And this I encourage the younger ones to do so without pride, to do so without arrogance, because within the health system, it is a teamwork, and teamwork means ensuring that you play your part and play your part effectively. However, you should not allow yourself to be pushed around. And for you not to be pushed around is to be on top of your job. If you're on top of your job, all other team members within that space would give you the needed respect.
Talking about leadership, mentorship and coaching, with the new transformation happening currently at the police hospital, would we say that the nurses have been brought to that standard of giving out their best when it comes to patients' care?
That is so obvious. I mean, you can observe that nurses and midwives currently in the police hospital are working with their chest out.
Wow.
Fact is that they have been mentored and received that confident astute lessons. They have built their competences level to the extent that they would want to express it without fear, with discipline anyway, because we live in a regimented environment. But I can tell you, we have a nurse midwife that you cannot just say anything and get away. Much as they know the rights of the patient and family that they care for, they equally expect that they are accorded the needed respect. And so it is a give and take situation.
Wow. How has the directorate or the management of the police hospital, how close can we say you are with the nurses, the midwives and other cadres in the hospital? Is there a day you come together? How is that relationship?
Fortunately, the current leadership, core management has improved on that aspect. We have administrative meetings, apart from the clinical meetings, which are purely on medical and perhaps allied health related topics that we discuss. We have what we call administrative meetings with the personnel, and we hold that twice in every quarter of the year. We intended doing that monthly, but sometimes it conflicts with major activities within the hospital, so we do it twice quarterly. And this is when we have General Assembly of Personnel, and during which pertinent issues of the hospital is discussed, and it serves a good forum for personnel to ask core members or management members questions that they feel are nagging, and they are addressed.
But is there a get together or a day you come together?
Yes, for the whole hospital, we have not had that. But relative to nursing and the midwifery directorate, we have our quarterly, half annually, and the end of year get together. Yes, and which is even a requirement by Ghana Health Service and Ministry of Health. So every quarter we hold a DEBA, and then half year DEBA, and then end of year DEBA.
Wow. Lastly, what message do you have for the public about trusting the police hospital for better care and service delivery?
Yes, so lastly, finally, but not the least, is that the police health service over the period has improved in their care delivery. The assurance is that we have very competent group of healthcare personnel who would miss nothing to ensure that you leave the hospital satisfied. And so my encouragement is that there have been improvement in the services, the equipment we use, and even the interaction of healthcare, personnel to the patient and their families. We know our core mandate is to care for personnel of the service. However, it is extended to the corporate society. So please do not hesitate to visit the hospital anytime you feel like doing same. I encourage all of you to come, especially policemen and their dependents. So please, you are always welcome. Our doors are opened and you are good to go.
Thank you very much, sir. Have today's episode on you and your health. Let's learn that nursing is not just